Welcome to your day 2 visit. Today we're going to be going over your x-rays, but before we do so, I want to give you a little bit of a warning. So the warning is this: here at Prince Health and Wellness, we only take patients that we can fix. This should be good news because we don't want to waste your time or your money. If we can't fix at least 50% or more of your problems, we promise to refer you to someone who can. The second warning is this: we're going to talk about how the structure of your spine dictates the function of your spine and what this means for your healing journey. But before we do that, I'd like to give you some basic principles and protocols so that you understand how we do things here. Now, you get to look at my drawings. Everyone loves my drawings. Okay, so when people come to see us, they look like one of 3 presentations. See this? This is a perfect spine. This is the arc of life. See this beautiful C-shaped curve? When your neck is curved in this way, all of the bones and the discs are evenly spaced apart. Perfect. Also, the thyroid gland sits way out in front, unencumbered. Perfect. However, most people who come to see us, unfortunately, look like this. When your neck becomes straight, usually because you sit at a desk or look down at a keyboard all day, your neck becomes straight and all the bones in the disc can get jumbled together like a traffic jam. Also, I want you to note that the thyroid gland will get pulled back and rub against the bones in the neck, causing it to calcify and cause dysfunction. Lastly, this is the worst presentation that we see. This is when the curve in the neck actually gets reversed. This usually happens when you're in your late 60s and 70s from degenerative disc disease. Now, like I told you, we want you to look like this, but most people look like this. And so what I tell them is this: normally the reason your neck becomes straight is either from chronic overuse, like at a desk job, or from a trauma. If you experience a trauma, the facet joints in the back of the neck will become locked in place, and it will cause you to hold your neck in a more straightened position. When this happens, all of the muscles in the back of the neck become tight like a bowstring and pull at the base of the skull. This can lead to headaches, loss of vision, tinnitus or ringing in the ears, dizziness, vertigo, and many other conditions, including loss of taste and smell. So we can see that we really want to fix this, right? Well, here's the problem. No matter how much massage and heat that you do on the back of the neck, it will never fix the problem because the problem is in the foundation. We have to fix the foundation and all the muscles will follow. Now, when your neck has become straight and stayed that way for a long period of time, what usually happens is the discs will be involved. And unfortunately nowadays, because of all the texting and looking down, I see younger and younger patients every day with disc herniations. That's what I want to talk to you about now. This is a normal spine. You can see vertebrae, disc, vertebrae, disc. These discs act as the shock absorbers to your body. They're like the tires on your truck. They carry the weight of your body and they should last you for 85 years. However, when a patient experiences trauma or the neck becomes straight, it puts pressure on the disc. That little disc can only take so much pressure until all of a sudden one day it will go pop and all of the contents will vomit out, kind of like this. When those contents vomit out, usually it causes pain because these contents are highly caustic, almost like battery acid. So they cause pain. They cause it to feel like you have a crick in your neck or a bad headache. And the patient usually may seek care or they might go to the ER because they're in so much discomfort. After a couple days to maybe 2 weeks, all of these inflammatory molecules dissolve and go away, praise God. However, the patient will now think that they're fixed. The problem is they're not really fixed. All those contents came out and now this disc is flattened like a little pancake. If that disc is flattened like a little pancake, these bones will begin to approximate and they'll get closer and closer and closer until one day they touch. We do not want the bones to touch. Listen, the #1 cause of suicide in our nation is when those bones touch. The #1 cause of narcotic abuse in our nation is when those bones touch. It's a medical emergency. When your bones touch, like in a fusion, your pain is unbearable. You can't stand it. And most people need resolution within 24 hours or they can't take it. What's my point? I'm not trying to cause you fear, but I need you to understand that we have to fix this before the fusion takes place. Now, with biophysics chiropractic, like what we do here, we fix the disc. That's exactly what we do. We take pressure off of the disc and allow the body to heal. Now, if we can't fix you, that's like what I said, we'll send you to someone who can, but we really hope that we can fix you. Now, these are the three main reasons for disc herniations: obesity, which is where we carry extra weight in the torso, it puts pressure on the discs; trauma, like in a car accident or in a sporting injury; and then altered spinal biomechanics, which is what I talked about here. So now we're going to talk about how specifically we can fix you. Okay, so now that you understand the problems in your spine, we need you to know that we're going to do everything we can to fix you, but you also have to do your part, and we're going to detail that for you now. So if you don't have any other problems like scoliosis or congenital anomalies, your care plan is going to be pretty straightforward. Each visit is going to be about 15 to 20 minutes in duration. When you come to our office, you will simply check in at the front kiosk. You'll see Kara's lovely face, and you'll sign in with all of your symptoms. It's very important that we know what your symptoms are for the day. That way the adjusting doctor can talk to you about your problems. Next, you will go to the lumbar spine rehabilitation room. In the lumbar spine rehabilitation area, you're going to see all sorts of people doing all sorts of different exercises. Now for you specifically, you're going to be doing 3 exercises. These exercises are forward flexion and extension, lateral bending, and rotation. These exercises are designed to, number 1, strengthen the core muscles. We want to give you a nice tight core, not a six-pack, but a tight core. Then we want to strengthen the extrinsic back muscles in your back. And we also want to pump toxins out of the disc space and flood hydration into the disc space so that we can get a nice plump disc once again. After you do your lumbar rehabilitation exercises, you will go into the neck traction room where you hang from a little neck traction unit on the wall. It looks scary, but I promise it feels great. Our patients absolutely love it, and it will help open up all those disc herniations and put the curve back into your neck. Next, you're going to stand on the vibration platform. The vibration platform shakes you all up, and it feels like you're in a tornado. However, the benefits are incredible. First and foremost, it increases blood flow to every single cell in your body. It also helps increase bone density, so people with osteopenia, osteoporosis really benefit from this. It also heals any stress fractures in your body. It acts like a bone stimulator. It increases proprioceptive input, so it helps you know where you are in space. It also increases muscle tone, decreases fat, so it helps you lose weight. But the main reason we're putting you on it is to help heal your discs at a very fast rate. Then one of your adjusting doctors will go over all of your images to make sure that we have all the specific angles and calculations so that we know how to adjust you perfectly according to your issues. So then you get your adjustment. Also, on your 4th visit, we're going to give you an at-home care kit. This at-home care kit basically mirrors what you're doing here in our office, and it is designed for you to do it every single day for the rest of your life. People always laugh when I say that, but it's really simple. It's only 90 seconds a day. You can do anything for 90 seconds, right? You can brush your teeth for 1 minute. You can do this, your spinal hygiene, for 90 seconds. On the 12th visit, we're going to be checking in with you. And if we see that you haven't been doing your exercises, at that point, we may dismiss you from care and give you the rest of your money back, because we know that the results that you see are not going to be good. In order for us to get 100% good, strong results, we need you to do your at-home care exercises. Lastly, on your 5th visit, we're going to measure your shoulders, your neck, and your ears to create a customized supportive pillow just for you. This pillow is designed for you to sleep on it for 10 years. You're going to love it. Our patients say that it's like sleeping in heaven. I've never had anyone return it, but if you don't like it, you can. Don't worry. All of these methods together help us have the best situation possible for your healing. Another supplement that we commonly recommend for you, especially for our disc patients, is collagen. If you're already taking collagen, great. The collagen we recommend here is research-based by Harvard and PubMed. It increases disc healing by 76% faster rates. So if we recommend that for you, we expect that you take it every single morning with 1 scoop on an empty stomach in purified water before starting your day, before eating anything. This ensures maximal absorption so that your discs on your post x-ray don't look like this, they look like this. Lastly, I want to tell you about a patient. One of our patients, Rachel, she had really bad scoliosis and several disc herniations. She did all of our protocols, all of our procedures, followed it to the T, and guess what? She gained 5 inches in just 24 months. 5 inches, she's 5 inches taller in 24 months. Why? Because all of her discs are now healthy and strong. So, in closing, what we've done with all of these procedures is not only have we plumped up the disc, we've made the outer layer of the disc stronger with collagen, we've put it in the right position with neck traction, we've made it really strong with vibration therapy, and now you're ready to know specifically what your x-rays show. We look forward to working with you. God bless you.